we will be learning about drugs and the nervous system, pharmacology, and psychopharmacology. We will spend most of our time discussing psychopharmacology on the different drug classifications throughout this course. Learning objectives for this week: explain how different drugs affect the neurotransmitters and their associated pathways within the nervous system. Articulate the long-term effects of substance misuse on brain function and behavior. That will be in correlation to psychopharmacology. Classify the processes involving drug discovery, testing, and approval, emphasizing safety and efficacy. Analyze how different drugs may interact with one another and the implications for therapeutic use and misuse. Examine how drug influence behavior, mood, cognitive across various populations. Compare the ethical implications surrounding the prescription and use of medication for psychological conditions. Let's dive into biblical foundations. 1 Corinthians chapter 6, verse 12. Everything is permissible for me, but not everything is beneficial. Everything is permissible for me, but I will not be mastered by anything. We can be distracted by our human ways and become addicted to any human entities such as drugs, food, and other human entities. But our God is the master and is never mastered by anything. So we need to emphasize on our privilege of personal freedom, but our responsibility in using that freedom. Be cautious against being enslaved by any controlled substances or human entity. In relation to substance abuse and addiction, it highlights the dangers of any addiction in correlation to it becoming dominant in our lives. It encourages reflection and what is truly beneficial to one's well-being. So making good choices, aligning your values in your walk of life with your biblical foundation. 1 Peter chapter 5, verse 8 reiterates to being alert and having a sober mind. Your enemy, the devil, prowls around like a roaring lion, looking for someone to devour. So being intentional, being alert, being present with God helps us be vigilant and self-control and being watchful over any distractions. It stresses the importance of clarity in mind and awareness in combating temptations and dangers. Substances can impair judgment and cause harmful influence. It reinforces the importance of maintaining personal integrity, awareness, aligning physical choices with spiritual well-being. So let's dive into the nervous system. Neurons are the basic building blocks of the nervous system. They are made of the cell body, the dendrites, and the axons. It helps cells communicate with one another. And when you interfere with an additional substance, it can change the communication throughout the cells. Neurotransmitters are chemical messages that transmit signals across synapses. When one communicates to the other, it sends off the communication of what the cell is being communicated to do. When a substance interferes in that communication, it changes the chemical makeup of the neuron. Drugs can mimic, enhance, and inhibit actions of a neurotransmitter. So we use pharmaceutical drugs to enhance and mimic neurotransmitters, such as an antidepressant. It increases and alters the brain levels of the neurotransmitters and inhibits other activity. And even opiates mimic endorphins. Drugs that fit receptors and prevents neurons from firing are blocking agents. We have agonists and we have antagonists. And agonists fit receptors and activate them, and antagonists fit but do not activate, stopping other from activating receptors. Other influences or examples of drug influences on neurotransmitters are like morphine and heroin and opiates, like we discussed. They are similar and mimic endorphins, and amphetamines are thought to act as stimulants by enhancing the release of neurotransmitter substances into synapse. And this also impacts how different drugs are tolerant and causes withdrawal symptoms due to the sensations of drug use. So the central nervous system is an intimate network of cells, and it carries signals throughout the body, allowing communication and coordination of bodily functions. And you have the central nervous system, which is made of the brain and the spinal cord, and then you have the peripheral nervous system, which are your sensory nerves and your motor nerves. Then we have the autonomic nervous system, which has sympathetic branch and a parasympathetic branch. The central nervous system helps create different divisions within the categories that we just discussed to create communication throughout the body. So long-term effects of substance misuse, it alters communication. If a neuron is interfered or altered in the receptors in the communication components, it causes a different communication pathway, which causes human beings to be tolerable of different drugs and become addicted. Structure changes and brain shrinkage. If you look at different substances and comparisons of someone that doesn't use the substance, you see shrinkage, which means reduction in brain activity. Impaired decision-making and impulse control happens with behavior implications between substance use, increased risk of developing mental disorders. We discussed a bit about comorbidity. Changes of mood and social interaction transpires when there is long-term effect of misuse. Neuroadaptations occur during this time when it transpires, which means that the brain becomes accustomed to the substance use, and that is where we discuss tolerable and addiction. There are various ways to compute drug dose, which goes into pharmacology. And usually drug dose is usually formulated by body weight and age. And sometimes that can be a bit tricky because during certain ages, especially with children, there can be a different size difference, a different body weight. So usually body weight is the best to compute drug dose. And the importance of pharmacology, there's two terms that should be very relevant. You have pharmacokinetics, the study of drugs, the way it moves through the body. And then we have pharmacodynamics, which is the study of drug effect in the body. And the reason why that's important, we need to know where the drug is focused on and what it impacts, and then the effects of the after effect of the drug. So how it impacts and moves through the body and how it affects the body. So pharmacokinetics, move through the body. Kinetics is usually with the movement of the body. Dynamics is the effect, pharmacodynamics. We all know that there's different routes of administration when we talk about drugs. The main routes are oral, injection, subcutaneous means applied under the skin, intramuscular means in the muscle, intravenous means in the vein, inhalation with, when you consume it by inhaling, intranasal, sniffing, sublingual, under the tongue, transdermal, through the skin. Absorption of drug is when the drug enters the bloodstream and the extent of what is experienced with the drug. Bioavailability is the portion of original drug dose that reaches the site of action and reaches a fluid in the body that gives it access to its site of action. There's factors that play into influence into how the drug is distributed through the blood. If it's fatty, and fatty lipids can cause it to be more readily absorbed. You also have if it's water soluble, if it's faster absorbed than it being in an oily substance, and how our body is our blood is circulating through our body also impacts absorption of drug. Again, discussing reiterates fat solubility. Drugs are soluble in lipids, penetrate body membrane, which action sites the brain more easily. Example, Valium is a highly fat soluble and passes easily through capillary and glial cell membranes. Elimination and metabolism plays a huge part in how we get rid of the drug. And usually we get rid of a drug through metabolism, means it's primary through the liver, excretion through the kidney. We also bowel, sweat, saliva, and exhalation. Term life, half-life means the time needed for the amount of drug to be cut in half. So when whatever time or duration it takes for the drug to become half its potency. Biological and psychological factors impact how a drug influences the body. We can inherit addictive traits through our biological and genetic components. Also, when it comes to the sensitivity of the drug, genetics can play a role in that. Psychological, we can also have addictive personality, be influenced by our environment and social factors that influence the use of drugs. Tolerance, there's different levels of tolerance when it comes to our addictive needs or when we're using drugs. And dispositional tolerance is increase of rate of metabolizing the drug with regular use. Functional tolerance is decreased behavior effects of drugs with regular use. Acute tolerance is a type of functional tolerance occurring with one single drug dose. Protracted is when your functional tolerance occurring over 2 or more drug doses. Behavioral adjustment of behavior through experience in using drugs. Learned tolerance and cross tolerance is when tolerance to drugs or drug never taken resulted from protracted tolerance to another drug. We discussed how our neurons and receptors and the neurotransmitters, which means the communication from one cell to the other, can be disrupted due to a substance, and it causes extreme impact on behavior, mood, cognitive, and it varies from population with variability. However, it's universal that it can impact behavior, mood, and cognition. It's important to understand how to provide good, ethical, sound decisions when we're dealing with drugs, substance use, and addiction. When we're prescribing drugs as a doctor or physician or psychiatrist, we need to be mindful of the history of the person, making sure that if it's a new patient, that we look into the history of their medical history to see if there is any patterns within misuse. We definitely have to break the stigmatism around mental health and substance use. Be aware, be more preventative in education and providing more insight on the impacts to the human body and mind. and have accessible health care for everyone. When there's not accessibility to treatment and recovery and rehabilitation, this is where the ongoing addiction and misuse of drugs occurs. Thank you for your time today, and I hope you learned a lot about pharmacology and the cognitive components of drug use and misuse, and we will see you soon next lecture.